I hope the white paper will bring more choice and control to those individual patients. I think that's the main thrust of it, allowing clinicians more freedom to work for better outcomes and life outcomes for the people we serve.
How do you view the prospect of competing with the private sector?
Well, we compete with the private sector now, sometimes in partnership with others. Sometimes I actually compete with the private sector for contracts. I hope it will improve value and quality, and I think value is about getting our costs down and our outcomes up. And I think that's quite a tricky thing in mental health to get right. I think we can compete, we can collaborate with people. I think you've got to be good at both in the NHS going forward.
Do you have any fears about providers from the private sector?
I do at times, in that they have a goal of making money for their shareholders. I have a goal of making really good services and building those services to help people recover their lives. I don't have to pay shareholders. So I do have a certain fear about that. That could divert very tight resources going forward to non-patient care. I don't like that. I think it's important we drive benefits for patients faster and harder.
Is the white paper going to give genuine choice to patients, do you think, in the mental health sector?
It might do. There's definitely an interest in having personal budgets. I sometimes call that genuine commissioning, when somebody's buying a service with real advocacy and control of what they want. I worry about fragmentation though. I think you might see consolidation of big providers because actually services fragment locally and people come in and begin to sweep up what's happening, and that could reduce choice in time. So at the moment, because we're at a maximum time of uncertainty, people are looking for coherence in the NHS, and we're not quite there yet. People are going to have to show local leadership to make things work locally.
How are you going to make that work in favour of patients?
By working with patients. I always say the answer's in front of my clinicians. The patient will normally know. They have a lot of information about their own conditions. Some people have to be guided because they're really unwell, or they can be quite dangerous at times. So overall, I think this is a good opportunity for us to really lock in what's good and tackle the variation around the NHS that I do see in mental health services. There's still too much variation.
Where do high security hospitals like Rampton fit in to the government's white paper and the management of them?
High secure hospitals, there are 3 in the country, are important, and they're important in their public protection role as well as the sort of people they deal with. There's about 700 high secure beds in this country, and they provide an important interface with the prison system, the criminal justice system and healthcare. We're very proud of the standards we set at Rampton Hospital. I think they will be protected in a way because they'll be commissioned nationally by a specialist commissioning group, and I think that's the right thing to do in those circumstances. I want to maintain the standards we work at Rampton. We're going to have to drive out some costs and generate the same public sector efficiencies as everywhere, but I think we can do that without reducing the levels of security. We've got a very good purpose-built environment up there. 140 million has gone in recently into providing some of the absolute world-leading secure services, and I'm very proud of those standards. I want to hang on to them.
So, from your perspective, this is a very positive time.
It's a positive time, but actually we've got to recognise 22% or something like that of costs have got to come out of the NHS. So just stand still with the sort of efficiencies and the cost pressures we have. That is a sustained challenge that we haven't had before in the NHS.
Can you meet that challenge?
I think we can. We need everybody to do that though locally, so that, if you like, the mental health services don't become the Cinderella services, that sort of balancing figure of what's left over. Nobody's called me Cinderella for a long time, and I don't intend to become it in the future.